Utilizing the DecisionDx test for melanoma gives me a lot of information in terms of what to do for my node-negative patients. So I've seen a patient, I've done a sentinel lymph node biopsy on them because they met criteria and they have a negative sentinel lymph node. So we're looking at stage 1, stage 2 patients. I am ordering the DecisionDx test for melanoma to assess their biologic risk of recurrence. So the way I explain it to my patients is we know that we utilize depth of the tumor to predict outcomes. Thinner tumors are less likely to spread and recur. Thicker tumors more likely to spread and recur. However, there's lots of thick tumors that I see that never recur, and there's lots of thin tumors that I see that do recur. So we know that depth does not explain everything. There's something about the biology of the tumor that's key. So I use this test as an adjunct for making decisions. If I have the pathology and I know I have a 4mm melanoma, well, how much more is this test going to offer me in someone who may already be at higher risk? Well, I actually think quite a bit because, as I said, 4mm, but not all 4mm melanomas are the same. And seeing what the biologic risk is, what the genomic profile of that tumor can inform decisions for how I'm going to follow these patients. So if they're a 2mm melanoma, or let's say even a 1mm melanoma who has a high-risk tumor, and depending on what their outputs are and what that risk actually is, using the individualized score on the DecisionDx test for melanoma, I can focus my surveillance for these patients. On the flip side, I can also de-escalate their care. If I know that they're low risk of recurrence, I can just send them back to the dermatologist with confidence that their risk of actually coming back is quite low based on both depth and genomics, that I don't have to follow these patients.